we think of the world without boundaries. The UK's population may be 60 million, and you just have 2 million students willing to become medical professionals in India. UK has a lot to offer to the world in terms of all the knowledge. This is the first medical school in India, at least that I know of, which is totally free of cost. This is where I think India and the UK can work very well together and contribute to the better healthcare in both the countries. The whole world cannot afford to fall sick because it's too expensive to fall sick.
Hello and welcome to Health Crosstalks. I am Lavina Tandon, and today we are going to really cross over the boundaries of United Kingdom and talk about how health and in every other sphere there can be oneness and world can actually be one place. We are being brought together by technology, but not in our hearts. And that's one person who is trying very successfully to do that is Sadhguru Sri Madhusudan Sai. Thank you very much for being in conversation with me. He's also the patron of Indo-UK Alliance and has attended BAPIO's 2024 conference. Yes. Please do tell me, you have been building hospitals and you saw the brilliant hospital that you're making. You run soup kitchens. Where do you see and how do you see a synergy between India and UK healthcare systems? How can India give to Britain, and what can India learn as well?
It's interesting that you mentioned about crossing the boundaries.
Yeah.
I think that is something. The mission's motto is Vasudhaiva Kutumbakam, one world, one family. It means we think of the world without boundaries, which is a very ancient Indian idea. So when you're a family, you're interested in each other's welfare.
Yeah.
So I came here, UK Indo Alliance that we're talking about through BAPIO. We are looking forward to working in these fields mainly. First, I think the field of education and training. As you know, in India, almost 2 million people write the qualifying exam for getting into medical schools, and close to 1 million qualify. But just 100,000 students get into medical schools because that's all is the number of seats available, and out of which 50% of the seats are in the government colleges, which are quite cheap, but the other 50% are very expensive. You can imagine that the whole of the UK's population may be 60 million, that's what I've told. And you just have 2 million students willing to become medical professionals in India, but due to lack of seats and opportunities, they cannot. India has much to offer in terms of workforce. It's a young country with a young population. Average Indian age is now at 28 and a half years or so. And for the next 25, 30 years, we can supply a lot of workforce to the whole world. Where we see a very great synergy and a symbiotic relation is to provide the right kind of workforce to come to the UK and not just get trained for the UK system of healthcare, but can also bring this knowledge back to India and improve the healthcare outcomes in India as well. And that is where we are very excited about working with this training academy of BAPIO, which can help us develop this particular field of expertise. UK has a lot to offer to the world in terms of all the knowledge that they have here. So we are looking at building a 1 million people team in India over this decade, who will be trained right from the preventive medicine, which is to work at the grassroots levels, at the rural shores of India, and also train them on very high specialized care like emergency medicine and geriatrics and pediatrics, which is also a very big necessity. And we ourselves have a medical school. And this is the first medical school in India, at least that I know of, which is totally free of cost.
Wow.
And that has helped a lot of these aspiring doctors who come from marginalized and underprivileged backgrounds to get into a medical school. And they're doing very well. There's so much of talent. And that gives me hope that we can bring many children to learn here and take some of them to India, because we have the kind of case loads. They will get a tremendous exposure in terms of honing their skills. So this is where I think India and the UK can work very well together and contribute to the better healthcare in both the countries. So we bring the workforce, you bring the expertise, we work together and share the outcomes and improve the health outcomes for all our people.
All the people. No, that's brilliant. And I think that to an extent is happening in terms of workforce. Another thing that I feel India can offer, and I would like your opinion on that, which no other country in the world has, which is Ayurveda. It's another form of medicine and that has not reached where it probably could. So you could reflect, please, on, is that on offering? And if so, what needs to happen?
Right. It's a very poignant point because I think India stood for its Indic knowledge systems in all aspects, including healthcare. And it's not just Ayurveda alone, but we have yoga, what we call as Ayush now. It's an integrated medicine scenario,
Yes.
which is kind of, we are reclaiming our past and
Yes.
slowly building on it. Yet we are a long way from there. A lot of institutions have been set up in India to develop the protocols scientifically, because the Western world or the Western patient would ask for the scientific evidence-based treatments. That's where we are working very hard in India. Many institutions, including sponsored by the government or quasi-government institutions in the field of integrated medicine, are working hard to come up with a lot of scientific evidence-based medicine, which will help us to convince the world that there is another way too. However, it is still, I think, not ready completely in terms of offering it as a curriculum or a protocol in the UK. We are working on that. As an institution in India, we are right now basically an institution approved by what we call a National Medical Council, just like you have here, General Medical Council. And this institution is an allopathic institution for the time being, because we do not have an integrated medicine institution in India still, where we can integrate both the streams of medicine. But we have standalone Ayurvedic institutions or yoga-based institutions, Unani and homeopathy and things like that. We as an institution are trying to integrate all these things, though it cannot be done formally because there is no structured approach to it in India. That's unfortunate, according to me. I've been advocating for it to try bringing all these streams together.
Yeah.
Because at the end, it's that one patient who should get well with whatever we can do. Where we don't have answers in English medicine, we can always go back to the traditional Indian medicine. So that is something that is worked on. It will take a while before it can be offered in a structured way in the UK.
Yeah, I think where we falter or where we fall out is really the scientific evidence and the research, R&D, to support the platform that Ayurveda can stand on. And I think that needs a concerted effort, as you very much pointed out. Before we leave, could you tell me your vision for the Indo-UK Alliance, maybe 1, 2, 3?
Yes, I think the first thing that I want to do is to ensure healthcare, high quality healthcare, is accessible to everyone in India and in the UK. And that would be one big vision of this alliance. Now, how will we do that? We are finding our steps. Second thing, develop a very large healthcare workforce, which will help both India as well as the UK. Many doctors are going to retire, many are quitting NHS, and burnouts are there. How do you replace all of them? With just the population of students in the UK, you cannot. You need to encourage international students. I think that's where we can bring a lot more talent into the country here and take a lot of knowledge to our country in India. And this is the second thing. And third, as I said, we want to work very hard in AI in healthcare, where we can do things faster and more efficiently, less of invasive and more of diagnostic kind of services. And that will help us to prevent diseases from happening. Because India cannot afford to fall sick. In fact, the whole world cannot afford to fall sick because it's too expensive to fall sick.
Because you work and live in India.
Yes.
And you work in healthcare. What are the 3 most important things that you want to do for the Indian healthcare system?
The first thing that I want to do is to make education in healthcare accessible to all, affordable. I'm not saying everybody can do it free, but make it easy for the kids, for the youngsters, for the aspiring doctors to train and get better facilities and better training. That's the first thing that we would like to solve. The second thing I want to do is to encourage rural healthcare. Because as you know, India lives in its villages. It is true even today. Most of the education and the healthcare infrastructure is set up in the urban areas. Urban people who are living or training in urban areas find it very difficult to go to rural areas and work. So we want to encourage rural healthcare through alternative technologies, by training them at their doorsteps, by bringing new diagnostic tools through AI and other ways, and bring healthcare to the rural doorsteps. That is the second thing which is very important for us, because that's where most of the children are being born. And if they are not healthy, we will not have a healthy nation. Third thing I really want to do is to integrate all streams of medicinal knowledge that we as a country possess. Unfortunately, it has not got the buy-in of the policymakers yet. But I mean, the grapevine has it that in some time from now, there will be institutions of integrated medicine, and I'll be the first to jump at it and try to integrate into our medical school.
What is the appetite for funding, for support, and for policy?
I think the funding part of it is, of course, very crucial because we are running it all free of charge.
Yeah, exactly.
And it's not easy. We also run educational institutions. We run a nutrition program in India which serves 10 million children a morning nutrition meal across government schools, 100,000 government schools. So it's a very large program. It's largely funded by well-wishers and philanthropists. As I mentioned, we have a foundation in the UK as well. They also support these initiatives. Not just in India, but we are working in 60 countries in various ways as per the need of the country. So yes, we have a large base of well-wishers and philanthropists who help us, but it's never enough. So we keep working to raise more awareness and raise more support across the world. The second thing that is happening good in India is there is something called a CSR policy, corporate social responsibility is a policy which mandates
2%.
that 2% of your profits you must give for social good. And many of the corporates are now slowly being aware of what we do and its impact, are partnering with us. We still have a long way to go. But I think that awareness and that mandation has really helped a lot of social organizations like us. On the policy side, I believe in the last 5 or 6 years, we have seen that the government has become more progressive and proactive because they know that the old solutions won't work for the new problems. So they have to identify and invent or whatever, reinvent themselves now. And that government is doing in some way. They're listening to us. The work that we are doing right now, I think in a couple of years, millions of data points will be available, all analyzed, all structured. And also in terms of evidence, it's provable that this works. And that is when we think we want to go to the policymakers and push them towards an integrated system of medicine and encouragement to the youngsters in taking all kinds of streams of medicine and not make only allopathy as the most celebrated medicine in the world. We want to ensure that everybody gets the same respect, the Ayurvedic doctor, the homeopaths, the yoga people, every one of them, because there is a science behind everything. It's just that we perhaps have lost those evidences. It works. The only thing we are not able to explain is how does it work.
Yes.
So it does work, but we don't know what is that thing which makes it work.
Yes.
So that is something we have started working on. We have programs, very happy to tell you, meditation programs where we study the EEGs, profiles of the patients, and try to understand how this meditation is helping them release the right kind of hormones and calming them down before the surgery, which is helping the doctor do the surgery better and the outcomes are better. So we're trying to integrate in our way.
Yeah.
And I think policymakers will listen to us when we have enough body of work as evidence.
Yes, exactly.
That's exactly.
Yes, that's exactly what is required. Evidence-based,
medicine.
Scientific evidence-based R&D, research and development on this. So I really wish you all the very best.
Thank you.
And really hope and pray that the one world that you're looking at would at some point, at some level, be a reality for us.
Absolutely.
Isn't it? Thank you so very much, Sadhguruji, and I really wish you the best. This is most amazing that even if a lot of the world is fighting for boundaries, there are many others who are actually trying to dissolve it and make the world a better place, make all us one and live in a more happy times. And this is what we are also trying on Health Crosstalks, to talk to people, engage and create a platform for exchange of ideas and make healthcare, at least better healthcare for all. Thank you. Take care and God bless.
A special thanks to BAPIO and BTA for making these vital conversations on Health Crosstalks possible. First and foremost, BAPIO, British Association of Physicians of Indian origin, one of the UK's largest multi-professional organizations championing multi-ethnic healthcare workers since 1996. Committed to excellence in healthcare, leadership and equality. BAPIO Training Academy. empowering medical professionals with top-tier training and development. Thank you ever so much, BAPIO and BTA, for making this conversation possible.